This podcast is brought to you by Progressive Insurance. Whether you love true crime or comedy, celebrity interviews or news, you call the shots on what's in your podcast queue. And guess what? Now you can call them on your auto insurance too with the Name Your Price tool from Progressive. It works just the way it sounds. You tell Progressive how much you want to pay for car insurance, and they'll show you coverage options that fit your budget. Get your quote today at Progressive.com to join the over 28 million drivers who trust Progressive. Progressive Casualty Insurance Company and Affiliates. Price and coverage match limited by state law. Reboot your credit card with Apple Card. It gives you unlimited daily cash back that can earn 4.15% annual percentage yield when you open a savings account. A high-yield, low-effort way to grow your money with no fees. Apply for Apple Card now in the Wallet app on iPhone to start earning and growing your daily cash with savings today. Apple Card subject to credit approval. Savings is available to Apple Card owners subject to eligibility. Savings accounts by Goldman Sachs Bank USA, member FDIC, terms apply. A few weeks ago, in the run-up to my kid going back to school, I started thinking about the new COVID shot. I knew it was coming out soon. I wanted to get my family all squared away. And then, of course, before the shot was available at our pediatrician's office, we got COVID. Earlier this week, I found myself sounding like a beleaguered mom telling this story to Jen Cates. On day 5 of school, we got an email. COVID in the classroom. My kid tested positive. Then I tested positive. I was like, oh my God, here we go again.
Here we go again, yeah.
Jen is a senior vice president at KFF. In her normal life, she directs the Global Health and HIV Policy Program. But for the past 3 years, she's been focused largely on COVID. Right now, that means monitoring the rollout of this latest updated COVID vaccine. It's been retooled to target the evolving virus. And significantly, it's the first COVID vaccine since the federal government stopped footing the bill.
It's a new era for COVID-19 vaccines, with the drug now being rolled out commercially. But several supply and insurance roadblocks are causing some confusion for people out there.
On the COVID front, as Americans roll up their sleeves yet again to get the latest boosters, some are being asked to pay out of pocket even if they have insurance.
Social media is erupting about this, too. Look at this. Trying to get my COVID booster this month and my insurance won't cover it. So that's fun. And PSA, despite having an appointment, despite being in the right place at the right time, despite having insurance, I was not able to get my COVID booster today. So to help sort out this,
I wonder if you had to put an adjective on the process surrounding this new vaccine in fall of 2023, like what would it be?
I would have said initially, so a few weeks ago, I was saying, warning, this is going to be bumpy. There's going to be bumps in the road. I felt like that was a certainty, but it's been more chaotic than I expected. So I guess chaotic, temporary chaos is what I would say.
Temporary.
Yeah, I do believe, and we can talk about it, that a lot of what's happening right now is going to be temporary. So it will smooth out. But yes, temporary chaos.
So today on the show, now that the government is largely out of the COVID shot business, will it be like any other routine vaccination? Or does adding insurance companies and pharmacies make an already contentious issue even stickier? I'm Lizzie O'Leary, and you're listening to What Next TBD, a show about technology, power, and how the future will be determined. Stick around. Reboot your credit card with Apple Card. It gives you unlimited daily cash back that can earn 4.15% annual percentage yield when you open a savings account. A high-yield, low-effort way to grow your money with no fees. Apply for Apple Card now in the Wallet app on iPhone to start earning and growing your daily cash with savings today. Apple Card subject to credit approval. Savings is available to Apple Card owners subject to eligibility. Savings accounts by Goldman Sachs Bank USA, member FDIC, terms apply.
This podcast is brought to you by Progressive Insurance. Let's face it, sometimes multitasking can be overwhelming. Like when your favorite podcast is playing and the person next to you is talking and your car fan is blasting, all while you're trying to find the perfect parking spot. But then again, sometimes multitasking is easy, like quoting with Progressive Insurance. They do the hard work of comparing rates so you can find a great rate that works for you, even if it's not with them. Give their nifty comparison tool a try, and you might just find getting the rate and coverage you deserve is easy. All you need to do is visit Progressive's website to get a quote with all the coverage you want, like comprehensive and collision coverage or personal injury protection. Then you'll see Progressive's direct rate, and their tool will provide options from other companies, all lined up and ready to compare, so it's simple to choose the rate and coverages you like. Press play on comparing auto rates. Quote at Progressive.com to join the over 29 million drivers who trust Progressive. Progressive Casualty Insurance Company and Affiliates. Comparison rates not available in all states or situations. Prices vary based on how you buy.
Let's sort of set the stage a little bit for like a really bad pun, take the temperature of how we're doing now. Where would you say kind of American public opinion is in regard to COVID right now? Is it just fatigue? Is it giving up? Is it fear? Is it somewhere in the middle of all of that stuff?
I think where America is on this in public opinion, and this is what our polls show, including our latest, very divided, mostly along partisan lines. If you ask almost any COVID-related question, as we do you intend to get vaccinated? Do you, think there's a rise in cases or a problem? Do you change your behavior? People who are Democrat are much more likely to say yes, and people who are Republican are much more likely to say no. So the division is real, and it's pretty strong. So that's one. Two, I do think there's fatigue writ large. It was a very exhausting 3 years, and we're all trying to figure out what it means for our futures. And we do know from the last bivalent booster that came out, last year, uptake was pretty low.
Yeah, tell me about that.
Yeah, from the data that's available, something like less than 1 in 5 people in the U.S. got the updated bivalent booster, which is not very high. And in fact, some of the highest risk groups that really it's most important for, people 65 and over, less than half got the updated booster. So why is this happening compared to December 2020 when the first vaccine was authorized and everyone just could not wait to get vaccinated? Well, there are differences. People were dying at a much higher rate back then, and there was really no end in sight. And so vaccines were the thing that really changed the equation.
What do you think the change in circumstances and the change in public opinion can tell us about readiness/willingness to get this latest shot?
I think the change in public opinion makes it hard to predict. Now, there's a little bit of good news potentially. Our new poll shows that when we ask people, are you willing or interested in getting this new COVID vaccine? 47% say they are. That's a lot higher than the share that got the booster. Does that mean it's going to translate into actual behavior? We don't know. It could take a while. And there's a huge divide. So 70% of Democrats say, yeah, I'm going to go get this vaccine, and only a quarter of Republicans say this. But a much higher share seems to be willing to go get vaccinated. Now, if they encounter challenges, which I'm sure we're going to talk about, that could dampen some enthusiasm for sure.
That's exactly why I wanted to ask you that question, because this is the first vaccine rollout since the public health emergency ended, and the first time that the federal government is not funding and distributing vaccines. So I would love it if you could explain to me how people who want these shots are supposed to get them now.
Right. So up until now, basically, we had probably the only time in the U.S. universal coverage, right, which we don't have, but we had universal coverage of COVID vaccines. The federal government purchased every single dose and provided it for free to anyone, regardless of their insurance status, their ability to pay, or really anything else. This has all changed. That's what commercialization is. And COVID vaccines are now entering into the private market like most things in healthcare. Now, what's supposed to happen, and this is what there's a lot of rules and regulations and laws that govern what can and can't happen when vaccines that are recommended go into the private market. The bottom line is, for most people who are privately insured or who have public insurance, COVID-19 vaccines should be free. You should not be paying anything for them. That's not exactly what's happening right now.
Yeah, I feel like should is doing a lot of work in that sentence.
Should is doing a lot of work, and it's sort of likened to the challenges that people experience with their healthcare all the time, where they go to get a procedure, it's covered, and they still get a bill. Or they go to have something done in network, and then one of the providers is not in network. We hear about these problems all the time. We just haven't had to deal with them with COVID. And also, the insurers seem to, they've known this was coming, but it does seem in several cases that they weren't either clear on the guidelines or just weren't adequately prepared to get this up and running right away.
And if you are uninsured and want to get one of these vaccines, what do you do?
Yes, I don't think prior to COVID, many people, other than maybe those of us who work in public health, knew that if you're an uninsured adult in the US, you don't have a guaranteed access to free recommended vaccines, whether that's flu vaccine or anything else. That's the bad news. The good news is the federal government recognized this and knew that for COVID rollout in the commercial sector, that wouldn't work for the uninsured, and has launched a program called the Bridge Access Program as a temporary sort of stopgap to provide free vaccines through a couple of different ways to the uninsured. There's two ways that that's happening. One is the federal government is actually purchasing some vaccines still that will be just for the uninsured. And those will be provided to, health centers and other sites that often are the sites that serve people who are uninsured. In addition, and this is unique to COVID, the federal government has partnered with 3 pharmacy chains and is said to these pharmacy chains, you can get free vaccine from the manufacturers directly, and we will give you a fee, a per dose payment for administering that vaccine to any uninsured individual. And the idea there is that for the next few months, maybe up to a year, that program would be in place so the uninsured who want to get vaccinated hopefully could find a free vaccine that way.
But of course, none of this is that simple in practice. Many people who have gone to get their shots say they turned up only to have an appointment canceled, or there was confusion over whether a pharmacy would take their insurance, or they've been asked to pay out of pocket.
I'm definitely hearing those things, a lot of those things. So there's a number of snags in the process so far. One is on the insurance side. What the law says is that these new updated COVID-19 vaccines were required to be covered for free the day that the FDA authorized or approved them. That was September 11th, 2023. And the other requirement is your health plan can say, yes, we know we have to provide these for free, but only if you're in network. If you go out of network, we might charge you co-pays. But the law says that's okay, except if you don't have the vaccine in your network, you still have to provide it for free if someone goes out of network. The idea being people are entitled to these for free with their insurance. And if the plan doesn't have it, they have to still pay for it. That's how it's supposed to work. What has happened, and there's many anecdotes about this, people walk into their pharmacy and they say, we're not ready to take insurance yet. We don't have that information to work with your insurer, or we're not part of the insurer's network. All kinds of things that, shouldn't necessarily be problems at this point, but are. In fact, one of my colleagues who also works on insurance issues, in fact, that's her full-time job, she went into a pharmacy, and because they weren't in her plan's network, they wouldn't give her the vaccine. And she said, well, my plan doesn't have any vaccine. And they said, we'll call your plan. And the plan said, sorry, we won't authorize it. And they wouldn't even let her pay out of pocket.
And this is someone who really knows this stuff.
Yes, she knew what to cite, and they could not get their act together to figure this out. And in fact, it's a violation because the plan did not have the vaccine in stock, yet wouldn't authorize her to get it out of network. And the poor pharmacist who was trying to help had no way in their system to make this happen. So point is, it did not work the way it was supposed to. And that experience is being repeated by others around the country. And, there's other points along the system that seem to have met snags, like pharmacists. Initially, some of them were saying their systems weren't ready. They didn't have the billing codes, or the insurers didn't have the billing codes. The billing codes have been available since mid-August. And my pharmacist, when I tried to get my appointment and I went and just to check, you canceled my appointment. Do you sure you don't have any supply? She said, we don't. We're getting so little, but they're still having us schedule all these appointments. So people are scheduling appointments, but then we're having to cancel them all. It's just not smooth yet.
But it's September of 2023. We've been doing this dance for a while. Why was no one ready?
Good question. I don't have the answer. There are differences. So the pharmacists, and it seems to be relatively smooth at pharmacies for the most part, they are used to this, right? They did this for COVID. They carried the COVID-19 vaccine. They provided, all across the country. They were a main channel for getting COVID-19 vaccines to the public. What's different now is the insurers were not in the picture before. And now they are. And that seems to have really shifted things. As we said earlier, it wasn't a surprise to them. They knew this was happening, and they do this for other vaccines, but for whatever reason, it's really created a snag in the system that's affecting a lot of consumers.
When we come back, is this just a little bump in the road, or does it say something more fundamental about our healthcare system?
ABC Tonight.
It just takes one great idea to change your life.
Shark Tank returns for its 15th season.
I didn't know I was going to cry right now.
With new guest sharks, Jason Blum of Blumhouse, Michael Rubin of Fanatics, and Candace Nelson of Sprinkles Cupcakes.
I'm going to make you an offer.
On a scale of 1 to 10.
I've never seen anything like this on Shark Tank.
This season is a 15.
I totally believe in you.
Shark Tank premieres tonight on ABC and stream on Hulu.
Critics are calling The Creator a masterpiece.
Joshua, take care of her.
I promise. It's the best film of the year. Phenomenal. The best sci-fi film in ages.
They're coming to get me.
I'm getting you out of this. The Creator is breathtaking in scale and vision. It's mesmerizing, visually stunning. See this film on the biggest screen possible. The Creator. Rated PG-13. May be inappropriate for children under 13. Now playing only in theaters.
Fall. It's the season of chunky knits and raking leaves and pumpkin spice lattes, and it's also the season of lawyers arguing for more and more of our rights to be trammeled by the U.S. Supreme Court. I'm Dahlia Lithwick, and if knowledge is power, then my podcast, Amicus, hopes to share the knowledge that you need to have in order to understand what goes into U.S. Supreme Court decisions, and when those decisions come out, what they mean for all the rest of us. Join us as we navigate a new Supreme Court term where 6 conservative justices in the court's all-powerful supermajority hope to hit their stride even as ethical questions swirl around them, and as the rest of the country is still reeling from the radical decisions of the past 2 terms. You can find us wherever you listen to your podcasts. That's Amicus, AMICUS, and we will talk to you soon.
There are so many players involved in American healthcare. Doctors and providers, of course, but also insurance companies and pharmacy chains and regulators and drug companies. A lot of cooks in the proverbial vaccine kitchen. Is it too simplistic to just say whose fault is this?
It is too simplistic because it seems to be more systemic and a sort of more of a statement about our healthcare system and how it's a little bit convoluted and complex. So I've heard insurers say it's the pharmacists, and I've heard pharmacists say it's the insurers. I can't say who's really ultimately at fault, but it just is a complicated mishmash of challenges that are playing out, I think, in front of everybody when these are usually in the background. It's usually an individual going to get their insulin who might have some trouble. Or, I remember a few years ago when pre-COVID, when I went to get my shingles vaccine, there was a supply issue and I had to wait because there was no supply, but nobody really paid attention to that. I think we're very laser focused right now.
Where do kids fit into all of this? Because at least as a parent of a young child, a lot of big pharmacies will not vaccinate a young child. And, some pediatricians' offices like ours say like, well, we're just sitting here waiting.
Yeah, kids is a different question, and I think presents some really unique challenges. So when the vaccine was authorized by the FDA, the updated vaccine and the recommendations that were made by CDC are for 6 months and older. So that's, basically everybody in the United States is able to get this vaccine. And for some groups, it's even more important. And you might have seen some of the data showing that there were, relatively, and this is all relative, high hospitalization rates among young kids. So a lot of parents are very eager. And from everything we can tell, there's very little vaccine available. Why is that? Well, one issue, as you already pointed out, is pharmacists pre-COVID, and I know this also as a parent of a young kid, I was always frustrated. I couldn't get my kid his flu shot at most pharmacies because they said, nope, we only vaccinate 12 and older or whatever age it was. And those ages are determined by state. And so I, as a parent, you're busy, maybe can't make an appointment at your pediatrician's and you think, why can't I just go to the corner like I do for my shot? During COVID, because of the emergency, HHS used a specific emergency declaration to basically say, we're saying all pharmacists can actually vaccinate kids down to age 3, even if their state won't let them. And they have liability protection and it's okay. And that was by design to allow many more places to provide vaccine. But not all pharmacies do that. And a bigger issue is that they mostly don't go below age 3.
Yeah.
And at the same time, pediatricians just haven't gotten the vaccine. I actually have heard of very few pediatrician practices that have it. I think it presents some real challenges to them, and as it did throughout the emergency, but even more now, how much should they order? Where should it come from? They may only have a couple of clients who want it. And so it's just a much more challenging process for especially smaller practices. So your pediatrician might not have it, and then your pharmacy won't do it. And parents that want to get their young kids vaccinated are kind of caught in this hole. And it's not clear yet what is going to be put in place, if anything, to fill that gap.
This is a self-interested question, but I'm just curious, why didn't this happen before kids went back to school?
That would have been a good thing, I think, except that the process, which, does follow a pretty strict process of FDA review, it was always targeted to take place hopefully by mid-September. And I think it's just whether it was a bandwidth issue because it's so much data to review or whatever, that's when it happened. And I don't know what the decision making was or if anyone actually said, hey, let's try to do this in August so that it could be ready, but it didn't happen. And so here we are. Fortunately, we're not where we were in December 2020 and January 2021, where there's just so many deaths and no hope, really. We're in a much different place. And for the most part, a lot more people are able, if they get COVID, are able to recover. But it is, no one wants to get this. And we have tools to either to reduce the likelihood, but also more importantly, reduce the impact if you do get infected.
In terms of distribution, are there enough vaccines in circulation to meet overall demand? How are people figuring out that part of the equation?
So the manufacturers, and right now there's 2, there's Pfizer and Moderna that have the updated vaccines. They have each said, we have enough, which is good. But these vaccines have to be ordered and then delivered. And there seems to be a little bit of a challenge there. And it is a balancing issue. It's not clear to me that those ordering the vaccines, pharmacy chains, for example, have figured out what the right number is and if it's coming fast enough. If we do remember, think back, this did occur at almost every phase of the initial rollout of a different part of the COVID vaccine, trajectory. The difference there was the federal government was sending them out and over time got much better at it. But now it's really back, it's the private sector that's ordering these. As I mentioned earlier, when I went to my pharmacy today, just to check, you canceled my appointment. Do you have any just maybe back there? And the pharmacist said, yeah, we're just not getting enough in. It wasn't clear to me if they're not ordering enough or they're not allowed to order enough or what the issue is. But there is something going on the supply side. And I don't believe it's that there's not enough vaccine somewhere. It's that there's like some kind of bottleneck somewhere.
Well, that brings me to this question of when the initial vaccines rolled out, it was bumpy. There were supply constraints. I remember, sitting on a website for hours trying to make an appointment for my parents, one in their 70s, one in their 80s. But then that process did smooth out. So is this a hiccup that we're seeing, or is it a sign of something more fundamental with the shift to a commercial market?
I think it's more of a hiccup. It's a big hiccup, right? But I think it's more of a hiccup because once this gets smoothed out, which it will, my prediction, and hopefully I won't be back here in a year saying eating a hat or something, but is that next time there's the next year when there's a new formulation that comes out, like there is every year for flu, this process will be smooth as we can expect. That by that point, all the systems and the recognition of the insurance rules and all of that will be in place for insured individuals. That's my prediction. So this is a hiccup and a big one for some people, but it should not continue beyond this period. If it keeps happening every year, it would be a sign of some bigger failure.
But I guess I wonder what the effects of the hiccup might be when we're already talking, listening to your polling about people being pretty easily dissuaded from getting this. If it's hard, what does that do?
Yeah, that is a real concern because so first of all, the group that's trying to get vaccinated now, I put myself in that group, mostly have reasons for doing it. The eager subset that want to do this and are willing to call around, look at onvaccines.gov every day, try to drive places, whatever. And if we're getting deterred, what does that mean? Well, I'm going to continue to try. And I think most of people in that group will, but I do know people who walked away when they were being asked to pay out of pocket. And, when we're talking about pay out of pocket, we're talking about $200. Not everyone's going to want to shell that out. And then I think the bigger concern I have is not necessarily that group of people who will continue to try, although some might just opt out. It's others who are hearing these stories who are sort of like, yeah, I think I'm going to go get that vaccine. It's free, right? Oh, wait. Or I think I'm going to get that vaccine. I'm sure I can just get it at the corner with my flu shot. Oh, I'm hearing reports that it's nowhere. Those individuals who are kind of on the fence or maybe somewhat interested, I could see some of them just turning around saying it's not worth it.
That raises a very interesting question about sort of responsibility. I mean, even for someone who does what I do, I'm asking you these questions about the complications in the system. Is there a chance that we risk discouraging people?
I hope we don't discourage people. I do think that anyone who's discouraged, it's an unfortunate from a public health or personal health perspective. I'm hopeful that these challenges will get smoothed out, and for most people, as they go about the course of their, healthcare decisions, will incorporate COVID-19 vaccination into their thinking. But we've just lived through such a difficult and divisive time that people will pick things apart as much as they can, and so hopefully these snafus won't result in more either discouragement or picking apart of COVID vaccines themselves and why they're even being offered. So, there are some risks there, but these vaccines are so important for public and personal health that they have to get out to the public.
As someone who spends a lot of time thinking about our healthcare system, I wonder if there are lessons that you have drawn from what you've seen in COVID vaccination over the past few years, how it has worked, how it has not worked, and what we as a society can do to improve public health, to make vaccination campaigns more successful, to look at this and say, okay, we learned some lessons. But what are those lessons?
Yeah, it's a great question. And there are those lessons. I think one is the way that the federal government chose to respond to COVID on the vaccine side was really unprecedented and really important. Very quick, supporting the funding upfront of trials, and then helping to accelerate that process, and then choosing to buy vaccines before there was even an authorization, and ensuring that there was a market. That doesn't usually happen in healthcare. And then going forward saying, okay, we've bought all the vaccines for everyone and we're providing them universal coverage, which we don't have in the United States for anything. It was, we are providing these. This is an emergency. Everyone's can get these for free. It doesn't matter if you are a citizen or not, if you have insurance or not, if you don't have any money, where you work, anything. And that's a real lesson that when you do that, it can have a far-reaching impact. It's true that there were still equity challenges and barriers for some groups to getting vaccination, but coverage was available, meaning they were free. So I think the lesson there is, if we want to move in that direction as a society, there are ways to do that. So that's one. Two, though, is even with all of that in place, as you said earlier, the beginning rollouts were really challenging. And why is that? Well, we have a federal system where we have the federal government and we have the states. And the states generally make most of the public health decisions. So even though the federal government was saying, here's your free vaccine, we're sending it to you, here's who we recommend should get it first, states were free to make their own decisions about who should get the vaccine, how accessible it was, how easy it was to make your appointment. And what that showed us is that from the public health perspective, having states and localities make all the decisions might not always work the best for the consumer. And then I think another lesson is equity. The good news is there was a lot of focus on equity in the rollout over the last 3 years. The challenge was there were still disparities because the challenges that some communities face are very, very deep-seated and systemic. And even providing free vaccines did not overcome all of those hurdles.
Do you think anyone else has learned those lessons?
I don't know. We'll see I think one question that are some of the changes that were made because of COVID, will they become permanent? So one example, we talked about pharmacists being able to vaccinate down to age 3. That seems to be a change that a lot of parents like, and it only is available for like another year under the declaration that the federal government has. So a question is there some trend to make that more permanent? Will states move in that direction and allow pharmacists to play that role? And that would be an example, I think, of learning that lesson that when you want to get public health measures out to the public, you really have to provide them in as many places as possible that are accessible and meet people where they are.
Jen Cates, thank you so much for your time and for talking with me.
Anytime. It's good to be here.
Jen Cates is a vice president at KFF. And that is it for our show today. What Next TBD is produced by Evan Campbell and Anna Phillips. Our show is edited by Mia Armstrong-Lopez. Alicia Montgomery is vice president of audio for Slate. TBD is part of the larger What Next family. And we're also part of Future Tense, a partnership of Slate, Arizona State University, and New America. And if you are a fan of the show, the best way to support us is to join Slate Plus. Just head on over to slate.com/whatnextplus to sign up. All right, we'll be back tomorrow with a special bonus episode ahead of Sam Bankman-Fried's fraud trial, which starts next week. I'm Lizzie O'Leary. Thanks for listening.